My aha moment in public health, or the echo from it, is the reason that I was late getting here this evening. For context, back in 1981, Dr. Jim Curran directed a task force to look at the very first cases of the disease that Dr. Marston was just talking about, AIDS. I joined the field 5 years later as an HIV/AIDS medical and community educator, and 12 years after that, in 1998, Dr. Curran recruited me from the Emory School of Medicine to the Rollins School of Public Health, where he was now serving as dean, to start a CFAR, Center for AIDS Research at Emory. At one of our very first organizational meetings with shareholders around the campus, somebody suggested that the CFAR and the Emory Vaccine Center collaborate on an evening seminar series that would help raise both of our profiles on campus. Well, I thought that was a great idea, and I kind of blurted out like, and we could serve food, and we'll call it the Vaccine Dinner Club. Well, their reaction was very much like yours just now, but when Dr. Curran handed the initiative to me to design and to organize and to run, that's exactly what I did. Having heard that as many as 30 or 40 scientists would attend a vaccine talk around HIV, I reserved an appropriately sized room for the first meeting and sent out emails to a couple of my colleagues to ask for help in advertising the meeting. In that email, which I begged people to treat like a chain letter, I said that if you wanted to come to our first meeting, we would have a wine and cheese reception, followed by a science talk from Vaccine Center Director Rafi Ahmed, followed by a casual buffet dinner. Well, the responses to that email started trickling and then just flooding in, which should not have been a surprise to me because this was a moment in history when you could not even get a cup of coffee at a federally funded meeting. And I was offering wine, cheese, and dinner. So, as many of you know, the CDC is sort of a separate nation state on the Emory campus. And I think almost everybody at the CDC came to that first meeting. By the time that it started, I had over 300 registrations for the meeting. And on the day, to this day, I swear I felt the ground just sort of gently vibrating beneath my feet as wave after wave of CDC employees were thundering down Clifton Road, apparently at a dead run, in the direction of food and drink-enabled science. And that was pretty cool, but my elation turned to panic when the milling crowd figured out that somebody had forgotten that in order to drink wine, you have to be able to get out of the bottle first. But fortunately, the Vaccine Dinner Club membership has self-selected from the very beginning for resourcefulness, and it turns out a surprising number of people carry corkscrews around in their pockets and purses. So, in very short order, an informal bucket brigade of scientists led by biostatistics luminary Bets Halloran set up to uncrate, open, pour, and distribute over 300 glasses of wine. The rest of the evening went really, really well, and I think that set the stage for the Vaccine Dinner Club being seen as a club, not a seminar series. So you would think, of course, that would be my aha moment, but no. And in fact, it still wasn't my aha moment 21 years and almost 200 programs later when the pandemic happened and the Vaccine Dinner Club had to go online. I still remember with vivid clarity walking up to the podium on March the 4th, 2020, to open a program called COVID-19, What We Know, What We Suspect, What We Fear. The presenter was Dr. Jay Butler, who was the Associate Director for Infectious Diseases at the CDC, and the program was well attended. In those days, our average attendance at a monthly meeting was 200. But I don't know how many people were there that night, and I really don't, because in order to ensure plausible deniability with the fire marshal, I stopped counting at 550. But let me put it this way, it was a 2-tier auditorium, and it was standing room only. And when I walked behind the podium and I looked out at this sea of faces, I stopped ringing the cowbell we opened every meeting with, and I just blurted out, Dr. Butler's talk is going to include an analysis of super spreader events. And speaking of super spreader events, I would love it if everybody here could behave responsibly and hold your breath for the next 60 minutes. So you would again think that would have been my aha moment, but actually it turned out to happen down the road when the Vaccine Dinner Club had reformed itself as an online Zoom event. And much to my puzzlement, it just kept growing. I thought that the VDC was going to implode in the absence of, free wine, but no, instead, the membership requests for the membership and meeting registrations were exploding during the pandemic. And then, one day, I figured out why. I was sitting at my desk and I was reading through the comments on a registration form for one of the upcoming meetings, and I won't forget what this said. It just said, thank you, Kimbi, for keeping the VDC going. My job is to increase COVID vaccine uptake in a part of the country that thinks COVID-19 is a hoax. And I live for these monthly opportunities to just relax, if only online, with my tribe, the people who get it. The Vaccine Dinner Club makes me feel less alone. And that's when I realized what it was that this club did, what I was doing, is that in a world that was increasingly making the trashing of public health and the trashing of public health professionals into a full-time job, the Vaccine Dinner Club had gone beyond being a place where you could access cool science to being a place where you could access a safe space, where you could come, hang out with your tribe of the people who get it, and feel seen, feel heard, and feel supported. That crystallization redoubled a few years later when I paused the Vaccine Dinner Club for the entirety of the 2024-25 season. And then when I restarted it this past September, I got literally hundreds of thank you messages from people. And this is people all around the world, because one thing I should have mentioned is that while the number of registrations and meetings were growing, I got to the point where I had to start each meeting with a slide showing the number of countries that were growing and growing and growing. People all around the world were coming in because we're all facing the same thing. And so, because of that, when this past summer the two major sponsors of the Vaccine Dinner Club told me that they wanted to reduce the meetings from monthly to quarterly, and they wanted to revert them to in-person only, which would make them only accessible to people in Atlanta, I felt like I needed to do something, because now I get it. I'm a public health professional, but my public is you. I do what I do so that you can do what you do. And I did not want that to end. I didn't want that safe space to go away. So my solution, let's start a second dinner club. With the support of the Rollins School of Public Health, I started another club that only meets in the months when the Vaccine Dinner Club is not meeting, now that it's just quarterly, and is Zoom for everyone. It's worked. We currently have, when I looked before this evening, 6,711 members, which is not bad for a club that didn't exist 2 months ago, and is 1,300 members more than the Vaccine Dinner Club took 27 years to accrue. Wow. which I think speaks to the need for a place for public health professionals to be in a space where they can be seen, they can be feel, and they can be appreciated. The first meeting last month was on public health crisis, what it means for America, public health chaos, what it means for America. And it starred Dimitri Descalasis, Deborah Howery, and Dan Jernigan, the three senior scientists from the CDC who resigned after the director was fired. Our meeting this evening started Dr. Hotez, Peter Hotez, and was about anti-science. So we are continuing to find new ways to try to reach people who do public health. I should mention, 2,600 people attended the first meeting. 100 of those people registered for the meeting retroactively so they could hear the meeting recording. And I will put out a QR code if you want to retroactively register and hear Dr. Descalasis, Dr. Hurry, Dr. Jernigan talk about what went down at the CDC and the downstream effects of it. But I also want to talk a little bit about anti-science. Before I end this evening, I want to read something if I can find it. Here it is. What I'm going to read you originally came from an email that I included in this month's advertisement of our as yet unnamed dinner club. That's the official title. Because I outsourced the naming of the group and we're still trying to do it. But this was for the as yet unnamed dinner club. And it came from conversations that I've had with Vaccine Dinner Club and VDC and UDC members who've reached out to me to talk about how distraught they are, how much I am, how much we all are over the deliberate big damage that's being done to public health these days. And this is what I wrote. This is what I want to end with. I keep reminding myself that perhaps the only advantage to being as old as I am is that I've lived a long time, including growing up in the Jim Crow South, which means that I have real-time memories of cross burnings, segregated schools, whites-only everything, and the Tuskegee study, which also means that I know from my own lived experience that we as a country are fully capable of righting great wrongs that are inflicted on us by our government because we have done so before. There is precedent for that in my lifetime. So I have to believe that we will get through this because we can get through this because we have gotten through worse before and come out on the other side. Thank you.